My name is Brittany Sandage, and I'm here at the DFAA headquarters. I will be manning all of the technical issues for today. We would just like to thank you for your patience as we got a couple minutes late start this morning. We will be answering any of your questions. We will also make sure, just as a housekeeping note, you'll receive your certificates for participation in an email blast as soon as the recording's over, roughly 2 to 3 hours, and you'll be able to access the slides as well. So without any further ado, I'd like to pass off the mic to Tony Coder, who's with us today from Washington, D.C., if I'm not mistaken. Tony.
Yes, I am. I'm from the nation's capital doing all kinds of fun stuff. It's actually a beautiful day here. I've heard it's raining. My wife said it's terribly boring in Ohio. So but it's beautiful here. And beautiful to be on with y'all. So let's get this started. Wanted to talk a little bit of, open this up with the budget. The budget is an extremely important issue that is happening right now in the State House. We're talking about literally billions of dollars of taxpayer money that will be given to organizations. It will be allocated to all kinds of things around the state. As I've stated in the past, Transportation and Bureau of Workers' Compensation have their own budgets. This is for the state operating budget. This is outside of those two entities, and it is the rest of the state of Ohio. Health and Human Services, mental health and addiction services, everything that you can imagine, even outside of healthcare, is going to be put into this budget. So there's a lot of lobbyists and a lot of folks who are looking at this and making sure that they get the share that they're wanting. However, with all that being said, the billions of dollars, last week, one of the most troubling pieces of the budget bill was that OBM, which is the Office of Budget and Management, which is an organization, which is a state, it's a state cabinet. Tim Keen's a state cabinet member. It's a cabinet level agency that basically watches over all the budget for the state of Ohio. OBM Director Tim Keen came in and gave testimony that there was a $203 million unexpected loss from what they were anticipating last month in the state of Ohio. The majority of that was income tax that they were not getting. That was the biggest. Decrease, $95 million less than anticipated. And when you're talking about those types of issues, in 2016, we're actually at about almost $615 million less than the year before at this time. So we're actually going backwards as far as money. The reason he went in and did this was that he wanted to give legislators a clear understanding about how the tax receipts and income for the state of Ohio is going. It does not look good now. $615 million is a lot of money. We have about a $2 billion what's called a rainy day fund, which that's what they kind of call it. It's basically a reserve fund, a savings account for the state, so that when budget issues come on very, very tight times, there is that backup that they can rely on to keep the state going. The previous administration had, which I was a part of, had spent this down to I think there was like 36 cents, or it was something terrible. Because of the recession that we had been in the previous number of years, and they have built that back up over the over the past six years. But now it looks like the state of Ohio is kind of heading down in that road where they're going to have to look at other avenues to meet their budgetary needs. There's not been anyone talk about the rainy day fund, but it is something when you're talking about two-thirds of $1 billion. That's not something you find in a couch. as you're searching for change. So what does all this mean? Basically, that any money for prevention is in question. Now, I don't mean to single out prevention. Any money for any organization is actually in question. Budget that Tracy, Director Plouck, maybe has had in the past, and some of her budget estimates may be on the, may have to be looked at. Same with the Department of Insurance, Job and Family Services, any other agency is probably going to have to look at some of their budget submissions and make those tough decisions. We are in the midst of a heroin epidemic. We'll probably in this year, the numbers I've heard of overdose deaths in the state are going to eclipse last year's record number. So we, obviously prevention, treatment, and recovery is still needed in the state level, and those funds need to be allocated to local communities. But this budget news is not real promising right now. So what we have to do is we've got to be diligent in talking to our legislators about the power of prevention. If you have not contacted your legislator to this point, you don't have to, if you don't feel like, if you can't do lobbying, just touching base with them, saying here's what's going on in regard to community. They especially want to hear about heroin, opiates, all that kind of stuff. And then what you have done, what your organization has done about prevention. You don't have to mention the budget bill. Just put the subject in front of their face. Let them know that what the work you're doing is valuable and absolutely crucial to the community's well-being and health. So again, that's how you kind of can get around the whole lobbying piece. You don't mention House Bill 49. You don't talk about the budget. You instead present the issue of prevention in your community. And right now, legislators are grasping at things to do in the community to try to stop this. The opiate epidemic is still almost a #1 priority in the legislators' minds. This was done through the governor's State of the State, which I'll talk about in just a second. But we have to be there is no more, crucial time that we talk to our legislators about the power of prevention, because the budget, if we are not, what I have learned about the budget, if we are not vocal, if we are not out there, if we're not talking to our legislators, to our community leaders about prevention, and you need your board to also understand and share this message, if we don't hear about it, then it's too easy to get cut. When they look at something, prevention, what do? Then it's too easy to be on the chopping block. And we need to make sure that any kind of increased funding that we might get is going to be kept in there through the House and the Senate cycle. So the House Finance, Health and Human Services Subcommittee is finished with hearing testimony on the opiate problem and those who need funding to defeat that in their communities. And now it's off to House Finance, which is why Director Keene went to Ryan Smith, the chairperson, and gave this testimony to talk about where we're at as a state. So we really need to touch base with our legislators. Again, not only us, but if your board member can say, you know what, I'm on the board of this local coalition or local organizations doing a lot to fight the heroin epidemic, we really need your support. We really need to know, to let you know what we're doing. That's going to be extremely valuable across the board. So if nothing else you get out of this and you fall asleep for the rest of it, then for the rest of this webinar, remember that. And I encourage you all to make calls to your legislators today, this week sometime, a simple 5-minute call and talk a little bit about prevention. So if we could have the next slide. Some of the companion bills that we've had, there have been a couple of bills introduced in the House and the Senate. They're exactly the same bills that are taking place. They were introduced last week, House Bill 167 and Senate Bill 119. They're basically opiate. They're kind of titled opiates and dentistry bills. What they say is that dentists cannot prescribe opiates unless the morphine equivalent is less than 50 milligrams. This is what this bill would do. This is not in law. This has not even had a hearing yet. This is what they're thinking at the statewide level, at the legislative level. If this were passed, you could not have be prescribed more than a 7-day supply of opiate meds. If you're having some kind of dental work, oral surgeries, those types of things done. So you could only have a 7-day supply. One of the interesting parts, and I will see how the Board of Dentistry takes this, is that you must complete 8-hour training on opiates and addiction. That is it's a day-long training. It's interesting that right now I think the addiction training for docs is 1 hour a year. 1 hour is all they have to do. So to do, to increase this by 8 times is absolutely amazing that they want to increase it by this much. We'll see how that rolls out with the board, with the dentistry board. They would also have to. That's just to the first year. After that, every year they would have to have 2 hours of continuing medical education, or CME, on opiates and addiction. So this would have to be an ongoing process, not only this year, where they have to have the 8 hours, but then 2 hours of CME after that. Also, it would be given to the dentistry board. They would be able to set limits to the amount of opiates that would be able to be prescribed. So they would be the ones setting for a tooth extraction. How much? What's your dosage? What's your maximum dosage? What's your how many days do you get it? Up to 7 days. All of that kind of stuff. We hear horror stories of folks having a toothache and walking away with a 90-day supply of opiates or 30-day supply, and this really kind of creates more stringent rules on dentists and those who are doing dentistry work. The other pieces that I found very interesting in this is that later in the bill they also included physicians. They talked about the medical board. They also must complete an 8-hour training on opiates and addiction. Again, it was Marcy and I actually fought for a little more training on addiction with the Medical Marijuana Advisory Commission, and they would have none of it. There was 1 hour, but this actually sets an 8-hour on opiates and addiction. Now, of course, this would include marijuana, but I would hope that would be a little more all-encompassing than just the opiate drug, but it would be an addiction subject as well. Again, mirroring what the dentistry board would do, you would have to have 2 hours of CME, continuing medical education annually on opiates and addiction. There's also kind of an interesting piece about tramadol. So you would not be able in the state of Ohio to prescribe tramadol unless these requirements are met, which is some kind of medication, pain relief medication. So these are kind of big issues. Again, they haven't had a hearing yet, but they're companion bills. Why do they do companion bills? Basically, they want, one will move forward usually, and it tees up the conversations in both the House and the Senate. So at the same time the House is debating, House Bill 167 in their committee, the Senate will also be debating the same bill, Senate Bill 119, in the committee that it's assigned to. So they're already going to have conversations. It speeds up the process by quite a bit, and lets folks, legislators know on both sides what each chamber is thinking. And this will be an interesting piece if this were able to go through. So we'll continue to look at that, and we'll probably ask folks to testify, especially if they're talking about addiction, you're talking about prevention, you're talking about treatment, maybe some of the other pieces, amendments that could be added that the dentists and other physicians could help out on. So we'll continue to follow those. Next slide, please. Thank you, Brittany. So the medical marijuana update in Ohio, the last Ohio Commission, Medical Marijuana Advisory Commission meeting, there was a budget for fees discussed, and it got a lot of play. There's a huge cost to actually putting this program into practice. You're talking about computer systems being set up. You're talking about ORS adjustments. You're talking about so many staff that are being that would have to be assigned. I think 10 within the Department of Commerce. I think there were 6 or 7 in the pharmacy that will have to be either reassigned or hired to manage this program. You're talking about enforcement activities. So it's a huge number. Now, the Cleveland Plain Dealer and all of their wisdom, and I say that with sarcasm, decided that they would write a story that said it doesn't cover, which was picked up heavily on the by the pro-pot people. That somehow the state of Ohio is trying to, screw patients out of money and all of this kind of stuff, be a big money maker. The money that we talked about actually goes right back into the program. In fact, I was a little bit disappointed that this is just to administer the program. There is no money for prevention. There is no money for local law enforcement and all of those folks. There's no money for treatment. There's no money for drug driving or homelessness or all of the other issues that we see with legalization of any kind in other states. So to write an article as falsely as the Cleveland Plain Dealer did last week is unconscionable to me. But we did see that the reporter was talking to the pro-pot side as we were leaving the meeting. So this is a case of just trying to jockey for cheaper fees in the state. The caregiver rules were also discussed. There was a young lady who kind of represents the caregivers, very nice woman, whose son has the epilepsy, and she was talking about in Ohio there'll only be 2 caregivers per patient, and she asked about hardship. If her and her husband had meetings, they have other children, if they had other meetings with, PTA, who would be able to take their child and administer things, or even if they just wanted to go out to dinner. So there's going to be talk about creating kind of this hardship person that caregivers would be able to appoint for these parents who or other caregivers. So this is something that I didn't expect a meeting. I'd love to hear your thoughts on and to discuss, so I'll be able to discuss it as well. Also, just to let you know, your local community, cultivator applications, the growers, their application will be released in mid-April, so probably the next just couple of days. Choices will be made by July. So if you're working with your community to ban and dispensaries and all of those types of things, the application process is upon us right now, and those choices will be made in the next couple of months. And that is done by law. That's within the language of the law, that those things have to be set up so that you have an operational program by 2018. So the next steps really are what you're doing at the local level. Are you going to try to ban cultivators? Are you going to what does your community think about those types of things? I was out in Denver, not last week, but the week before. It is amazing how much it smells in Denver. just because of the grows. We had to actually even take back a rental car because the pot smell kept pouring out of the vents in the car, so we had to take it back. But it's just, so the smell is going to be the biggest issue. There's a lot of security rules around cultivators in the state of Ohio. It's going to be the smell. It's like living next to a trash dump, except it's skunk instead of trash odor. So those next steps, you're going to have to consider very, very quickly whether you want to take this issue up with your local community leaders. Next slide, please. In my other role with SAM, I did want to give a SAM update. Why do I want to do this? Not just to promote SAM, but also I hear so much about, oh my gosh, legalization is inevitable. And so I want to give an update so that you are able to answer questions. It really isn't inevitable. Rhode Island and Vermont are fighting legalization bills in their legislature right now. We're hoping to win both of those. Delaware, I actually meet with those folks tomorrow to get them organized. We use the Ohio example on how to get those folks organized, and we hopefully will come away with a bill with a win there. Illinois also has a bill in their General Assembly to legalize marijuana. All of these are based on basically tax revenue. SAM has come up with a document that is basically what we call a cost document. One of our research and law guys actually wrote it. And basically it kind of analyzes the cost of legalization versus what the tax revenue will be, and it doesn't come out well for any state that legalizes. They're always going to be operating in the red because of the ancillary costs with legalization. South Carolina actually defeated medical marijuana in their state. That's a secret, so don't say it. But they are going to defeat it, I guess, this week, I should have said. So let the cat out of the bag. Michigan, we're trying to organize as well. In 2018, they will have a recreational ballot initiative in the Wolverine state. We're working with them, trying to get them organized. Connecticut should be able to defeat legalization in the next couple of days. You should be able to announce that. So we're having a lot more wins than we are losses. I mean, you're talking about New Hampshire, you're talking about New Mexico, you're talking about South Carolina, Tennessee, all defeated their either medical or recreational legalization tactics, and we're hoping that Rhode Island, Vermont, be more public about Connecticut and South Carolina. So when someone says it's just inevitable, it's a tidal wave, there's not been one win. Other than I guess West Virginia did pass a medical bill last week, or passed out of committee. But we're pleased, because legislators are understanding this is not a something that lives in a silo. So please let us, understand that we are fighting, and we're actually winning the majority of states in this country. So next slide, please. So federal issues. Marijuana, I know I don't have that much time. So marijuana, we still are kind of in kind of this strange period where we don't know what the federal government's going to do with marijuana. I met with Sessions' office yesterday, and they gave us not a whole lot we could go on, but they are still trying to figure out what to do with this industry that they have in Colorado. The new ONDCP interim director was named. His name is Rich Baum. So that's a good sign that ONDCP will stick around. Their website's back up, which is another good sign. Is it going to be a cabinet-level agency again? Probably not. But changes have happened, and like I've said in the SPCA meetings, I try not to speculate on what this administration is going to do. the Opiate Commission was named by the President. Chris Christie will direct the commission. And they're naming it the President's Commission on Combating Opioid Abuse, Addiction, and Overdose. One of the folks on this is Dr. Bertha Madras, who many of you know. She spoke at CADCA this year. I think she's spoken at Prevention First Conference in the last fall, or maybe it was in the spring. But I know she's been in Ohio and worked with some groups here. So she is on this commission. Professor from Harvard, very, very bright woman. Also, the President's budget has given a $500 million increase to combat opiate addiction into the country. So we're hoping that continues to stay in the budget. There's a lot of talk about how do we beat this, but there's very little money that's actually getting to individual states to actually help fight it. So these federal issues are something that we need to pay attention to as well. Next slide. I think it's a final slide.
That is the final slide, Tony.
Oh,
we do have a few questions if you have a minute or two to share with us.
Beautiful.
We had a question submitted by Alice asking whether or not we foresee the Opiate Commission at the federal level replacing ONDCP. Are there any conversations or thoughts we can offer to that?
No, that will not take place of ONDCP. We're hearing that, in fact, this commission, frankly, across the country is getting panned, not getting great reviews by reporters and such, saying that it is not a big enough step. We're facing a huge crisis, and we basically have put together a panel. So this will not defeat, and there will be a lot of pressure on this administration to do more with this, but this is a first step, I'm hoping, and this will not be the be-all and end-all, and we are not hearing that it will actually replace ONDCP. They're still looking for a director, and I don't think Chris Christie will be that director. He will just direct this commission. So that's what we're hearing, actually, as I'm sitting here in D.C.
Excellent. Thank you very much, Tony. Everyone, thank you so much for joining us here today, and thank you for bearing with us as we went a few minutes over. We know your time is precious on these Tuesday mornings. Please save the date for the next advocacy webinar, which will be Tuesday, May 9th. Again, at 10 a.m., you will get registration instructions and one of the forthcoming legislative updates. At this point, I know we had one or two very particular questions. We will make sure to address those unique to your local situation over email between Tony and myself. But if there are no further issues, we just wish you a wonderful day, a wonderful week. And thank you very much, Tony, for sharing your time with us from the nation's capital.
Hey, thank you.
Have a great day, everyone.